Hi, everyone. This is Sean with the MassSupport Network here with the Massachusetts Public Health Report for Friday, April 23rd, 2021. So good news is that things are turning downwards here. Over 4,000 fewer estimated active cases in the Commonwealth this week over last week. When we look at people under quarantine, as people who had exposure or waiting test results, last week we had about 11,800. This week, about 11,500. So not a significant drop off, but again, quarantine is probably going to be a less useful metric now that so many people have been vaccinated, as people are less likely to need quarantining, as guidance no longer says they have to quarantine after exposure or travel. So in terms of isolations, on the other hand, these are people who have confirmed COVID cases and are under isolation. There were just under 36,000 people in isolation last week. Now that's down to just over 32,000. So it's a significant drop off there. Still a lot, but moving in the right direction again. So the age demographics have changed a bit there. The average age of new hospitalization has gone up 2 years for the last 2 weeks, and the average age of a COVID death in the last 2 weeks has gone down 4 years. So again, as the most vulnerable population, the seniors who are the most heavily hit by COVID deaths have been largely vaccinated. We're seeing a lot fewer deaths in that age group. So that is a positive thing. And we're also seeing fewer deaths in general than we were seeing before. In terms of hospitalizations, everything is trending in the right direction with fewer people in hospital for COVID-19, fewer people on ventilators, fewer people in ICU. Now, not a lot of change on those more critical care measures, but still moving in the right direction at least. When we look at testing turnaround time, slight decrease in the turnaround time. Things are still steadily under about 30 hours for turnaround time on testing, which is great. And when we look at the state as a whole, every county trended down in the incidence rate from last week. So that is the number of new cases per day per 100,000 people. So the state average was 27.4 new cases by population. This week it's down to 24.7. And we saw reductions everywhere. Some places were less. Bristol, Essex, Hamden did not trend much. Other places dropped a lot more. Barnstable, for example, came down quite a bit, recovering from that surge. See, the biggest incidence rate is still going to be the Dukes Nantucket area, which has very few people, so it tends to throw off the numbers there. That things are generally moving in the right direction. We can also see that in the percent positivity over time. That's the percentage of COVID tests which are coming back positive. We have the bottom line is the screening testings done at colleges and universities. The middle line is the state average, and the gray line is what the state is doing when you remove the college testing, which can skew the numbers lower, and everything came down a bit this last week. The state overall dropped about 0.5%, which is great, but even the college screening tests dropped a little bit, which is also important because as screening tests, those are less likely to come back positive. And so just kind of show in a unexposed population what the positivity is. So that coming down even lower is also a very positive trend. So looking at the 7-day average of new cases, this is how things have been since early March when we hit our lowest point. And you can see we had that last bump for the end of March, beginning of April, and things are trending downward again. Now, usually the last day or two on here is a little lower than is actually going to be because this is going by test date, so we may not have data back on all of those, but still we've had a steady decrease to the point where we're almost where we were in early March, which is great progress there. One final thought to go into your weekend. Here's just one more from XKCD with a little suggestion about what we should do once COVID gets to a point where it's just another virus that is not a major problem. Maybe we should globally eradicate it out of spite. And the follow-up text to this comic was, of course, when you get to hell, tell smallpox we say hello. And for more from the MassSupport Network, you can find us on our website or on social media. And remember, wear your mask, wash your hands, and we'll be there when you need us. Stay safe.